Hi, good morning. My name is Elizabeth Walsh, and I'm a clinical health psychologist at the Osher Center for Integrative Health at Vanderbilt in Nashville, Tennessee. And I'm honored to get to speak to you today. And I'm grateful to be part of a community of colleagues who chose to start the day this way, who understand the importance of acknowledging the reality that many of you attending today have likely experienced invalidation and harm in the process of navigating and accessing medical care. And I do this work because I'm not only a clinician, but I'm also a patient. I've lived my whole life with chronic symptoms, and I've carried many diagnoses, some of which were incorrect, some of which are stigmatized, and fortunately, some of which have given me some degree of understanding of what is happening in my body and some direction for treatment and self management. So I get it. I have felt all sorts of emotions about my own journey, and we want to make space for you today to have all sorts of emotions about your own care journey. And my colleagues will share with you information about how integrative health approaches, like yoga, mindfulness, nature immersion, may provide resources for enhancing your own physical, emotional, and spiritual well being. We believe in the value of these approaches. We use them ourselves, we have felt their benefit, and we've seen them benefit the patients we treat. But we absolutely want you to know that we recognize they are not silver bullets. And many of you have likely spent years going to all sorts of doctors, all sorts of treatment providers, many times after long waits for appointments, often at a very high cost, trying to get answers and find treatments so that you can feel better. Unfortunately, living with chronic symptoms often feels like a part time or even full time job, and one that not only doesn't pay, but costs you money, often lots of money. And I can bet for many of you that this experience has felt frustrating, exhausting, and somewhat fruitless. And these feelings are understandable. This is hard. The unfortunate reality is the Western medical system is not set up to diagnose or treat complex chronic illnesses. Western medicine has carved the body up into parts and systems. And this division and specialization works great when what you have fits neatly into one of these boxes. But when it doesn't, you're left feeling like a hot potato passed around from one specialist to another, no one wanting to hang on to you. And unfortunately, our medical system and our broader culture doesn't encourage or praise humility or admitting, I don't know. So when there's no obvious diagnosis, medical professionals may not acknowledge just how much about our bodies and how they work isn't known or understood, which is a lot. And instead, you may be told that what you're experiencing must not be real, is all in your head, or isn't actually that bad. So you should just suck it up and move on. And on the one hand, we all get the message from society at large and the medical establishment to take responsibility for your own health. But on the other hand, many times when you try to seek care to address symptoms or concerns, you're told not to worry about it or that you're being anxious or fixating. And those who hold marginalized identities face even more challenges. If you're a person of color, if you're neurodivergent, have a large body, identify as LGBTQ, have a mental illness, are a woman, or any number of other identity characteristics, your experiences have also no doubt been impacted by implicit and explicit biases held by providers, staff, insurance companies, and other aspects of the system. And if you don't have access to health insurance, if you live in a rural area, if you have to work or caregive full time, or if you just simply don't have financial resources, you may simply not be able to access care or try to figure out or address your symptoms at all. And I do want to acknowledge that those providing healthcare are also harmed by the system. Pressure to see more patients, spend less time with those patients, and generate as much revenue as possible through tests and procedures. And we all know that burnt out, frustrated clinicians have even less to give to try to figure out or provide support for symptoms and conditions that aren't easily diagnosed or treated. It's also important to acknowledge the ways in which integrative health and wellness spaces can also do harm. So, while the integrative focus on the whole person provides opportunities to look at symptoms more systemically and acknowledge the toll of feeling bad, even in the absence of clear disease or injury, but there is a danger in reducing any and all symptoms to a systemic imbalance that can be treated via lifestyle changes or sowing false hope for unproven systemic miracle cures. Starting the day with this acknowledgement is not about being negative or pessimistic. It's about creating space to name the reality that the experiences that brought you here today have been painful, difficult experiences. And validating pain, anger, and disappointment isn't the same as becoming stuck or wallowing. And in fact, it's often what allows us to rally the strength to move on and keep going and operate from a place of hope. I've spent the last decade working with people living with complex chronic illness. And what I have seen over and over again is truly incredible courage, resilience, and grace. And so I encourage each of you to make space to validate your own difficult experiences and reflect on your own patience, your own strength, and your own resilience. So I'd like to close my time today with a poem from the Persian Sufi poet Rumi, which many of you may have heard before, called The Guest House. This being human is a guest house. Every morning, a new arrival, a joy, a depression, a meanness, some momentary awareness comes as an unexpected visitor. Welcome and entertain them all, even if they're a crowd of sorrows who violently sweep your house empty of its furniture. Still treat each guest honorably. He may be clearing you out for some new delight. The dark thought, the shame, the malice. Meet them at the door laughing and invite them in. Be grateful for whoever comes, because each has been sent as a guide from beyond. Thank you all for being here, and I hope that your time today is time well spent.